Coronavirus effect on body. How does coronavirus affect our lungs? Coronavirus spreads by droplets from the mouth and nose, and you can pick it up by touching someone who is infected, for example, shaking hands, by touching a contaminated surface, or by breathing in an infected person's respiratory secretions. But what does it actually do to you once entering the body? For the vast majority of people, more than 80%, the virus will cause only mild symptoms and pass like a common cold. But data from China show that about 14% of cases are severe and 5% are critical, with patients ending up in intensive care, needing help with breathing. The death rate is somewhere between 2 and 4% in Wuhan, the epicenter of the outbreak in China, but less than 1% in the rest of China and the world. What happens when the virus enters the body? When the virus enters your body, it binds to two cells in the lungs, goblet cells that produce mucus, and cilia cells which have hairs on them, and normally prevent your lungs filling up with debris and fluids such as virus and bacteria and particles of dust and pollen. The virus attacks these cells and starts to kill these. So your lungs begin to fill with fluid, making it hard for you to breathe. This phase of the disease is thought to last about a week. At this point, your immune system will start to kick in and fight off the invaders. You will develop a fever, and your high body temperature will create a hostile environment for the virus. You will start to get rid of the mucus in the form of coughing and a runny nose. But in some people, particularly the elderly and those with other health conditions, the immune system can go into overdrive. As well as killing the virus, it also starts to kill healthy cells. This heightened immune response can trigger a cytokine storm. White blood cells activate a variety of chemicals that can leak into the lungs, which, along with the attack on the cells, damages them even further. Scans of the lungs show ground glass opacity and then crazy paving patterns as they fill with mucus, making it harder and harder to breathe. Bacterial infections can also take hold at this point, and your weakened immune system will struggle to fight them off. This heightened immune response can lead to organ failure and death. Some people who recovered from severe acute respiratory syndrome (SARS), which swept the world in 2002 to 2003, had long-term respiratory problems as their lungs were permanently damaged. COVID-19 is similar to SARS in some respects, although is much less lethal, so those who have recovered from more serious symptoms may also suffer some long-term effects. While people with weakened immune systems and the elderly are more likely to become critically ill. The younger and healthy in China and elsewhere have also succumbed to the virus because none of us have any immunity to this new disease. However, one interesting factor is that children do not seem to be falling victim to COVID-19. Just 2.4% of all those who have contracted the disease are 18 and under, and the vast majority have mild symptoms. In other respiratory diseases such as flu, children are key disease transmitters. How to stay safe? The single best thing you can do to stop the virus is to wash your hands frequently and thoroughly, particularly before you eat. Face masks can stop you spreading the virus, but they are unlikely to prevent you picking it up from someone else. This is because they have to be changed frequently, and removed and disposed of properly. The virus is most likely to enter your body from your own contaminated hands when you touch your nose, eyes and mouth. We touch our faces up to around 23 times an hour, studies suggest, and this is the prime route of infection. So don't panic, wash your hands frequently, maintain social distance and stay safe.